So in this video I would like to talk about rests and why I don't use them. There are some occasions when I will use a rest, but mostly I don't. I use what I call the reciprocation technique. It's a little bit difficult to describe, so maybe I'll draw a picture or something and get it on the screen so that you can see. If you imagine the shape of a tooth, you've got the top surface and the sides, so the occlusal surface and the mesial distal, and then the labial and the lingual. And the idea of a rest, see, is to sit on the occlusal surface so that the denture doesn't displace downward. Okay, now the problem that I've got with that is, first of all, that you usually have to adjust the tooth, so you have to remove some of the tooth which is damaging the tooth in order to put that rest on. And then what I've seen, certainly in my experience over the years, what happens is that rest that's pushing down on the tooth causes the tooth damage, and ultimately it fails, or the tooth gets chipped or things like that because it's been weakened where the rest has been cut into the tooth. But the biggest thing is that I notice is that rest, when it sits on the surface of the tooth, there's no wiggle room for any movement at all. So and that's where the biggest problem is. When you've got a partial denture that is just sitting on natural tooth and it's not being supported on any soft tissue at all, that's the only situation when I can see that the rest seats can actually work. So in those situations, let's just say that you've got 4 anterior teeth, 4 anterior lower teeth, the rest of the teeth are natural, and then you put some rests on those teeth, both sides of the denture. It sits down, and all the occlusal force of that denture is just going to be on those anterior teeth, which isn't really going to displace it, and the denture is not going to move at all, and so those rest seats will work. However, I would question how important they are in that situation. Certainly if you've got the metal framework is on the lingual surface of all the teeth, and then you've got some clasps on there which are reciprocating around to the buccal side of those teeth, that denture is going to be pretty solid. It's very unlikely that it's going to move anyway, so I don't think you need the rest seats in that situation. If you've got a denture that, let's just say you've only got a few teeth remaining, a couple of 6s and maybe a 4 and a 5 on each side or something like that, where you put those rest seats are gonna count. I see them being put in places that are not ideal. From what we're taught, they should be the furthest away as possible, so you'd put one on the distal side of the 6 and then on the mesial side of the 4, for example, so that they're as far apart as possible. However, usually we would see on the mesial of the 6 and then the distal of the 4, because that makes it easier to make the chrome framework, for example. But in all these situations, what you're going to have is compression of the soft tissue. So as soon as the patient occludes and you get compression of the soft tissue, the denture is then going to pivot on one of those rests, and it's going to be on the 4, and the 4 will probably fail before long because of the pressure that's putting on it. The whole occlusal force is, because it's pivoting on the 4, it's putting no pressure on the 6, and so the 4 is just taking the brunt of that strain on the occlusal surface. The way that I would do it is I wouldn't put the rest on the 6 or the 4. Both would be reciprocated with a clasp anyway, and then the downward force on the pressure allows a little bit of movement of that metal framework down into the soft tissues. And we're not talking much, we're talking less than a millimetre, a fraction of a millimetre, but it's enough to not put the pressure on those teeth. Now, if those teeth are not reciprocated with a clasp, that downward pressure could push the tooth buccally or labelly, which obviously isn't ideal. But if it's reciprocated with the clasp, then that downward force is translated on both sides of the tooth, pushing it down the same way that a rest would, but it's not so harsh. It's got a little bit of movement there. And obviously teeth are on a ligament, so they've got some movement anyway. Typically not so straightforward as what I've just said, and obviously every case is individual, and you have to look at those cases one by one basis. So I'm generalising, but then you could say, well, the tooth then, if you don't put a rest on the tooth, the denture, is going to push right down into that soft tissue, and there'd be no support on the tooth at all. But actually, it's not correct. If the denture is designed correctly, if you look at a chrome denture in the way that it's designed, the metal framework always sits above the undercut of the tooth. So what we would do when we're designing a chrome is that we will survey the model and mark the highest point of the undercut, and then the metal frame will always go above that, where everything below that undercut is blocked out, so that the dentures can obviously come in and out. So what that's saying, if you've got the curvature of the tooth, how am I going to describe this? So if you've got the curvature of the tooth like this, and the denture's only brought up to that point of the undercut there, and then as soon as the patient occludes, it's going to push it down into the soft tissue. However, if you just go over that undercut just a little bit, it acts as a rest. The denture is literally resting, not on just one single point of the tooth, but all the way around the tooth, as much around that the top of that undercut of the tooth as you can get it. And then the other side, you've got reciprocation of the clasp. Now the clasp, the last third of the clasp is the bit that engages the undercut, which means the other 2/3 of the clasp is above the undercut, which is also acting as a rest on the tooth, which means actually putting a rest on the tooth is not needed, because it's already got, the clasp is acting as a rest. Unless you're, well, even if you're doing a, let's say, gingerly approaching clasp, like a roach clasp or something like that, where it's not reciprocating all the way around the tooth, it's still coming up the other side and reciprocating onto that tooth. And the reciprocation that I'm talking about that's important is so that the tooth then doesn't displace outwards. So the pressure, as the denture pushes down and it's above the undercut, is going to push that tooth, and then there's a risk that the tooth will move out over time. But not if that tooth is reciprocated, or if that metal framework is sitting on all the teeth all the way around. They're not all going to move. They're only going to move if there's only a few teeth, and if those teeth are not reciprocated with the clasp. I hope that makes sense. But essentially, the chrome is resting on the surface of the teeth, not on the occlusal surface. We're still on the buccal surface and the lingual surface of the tooth, but we're above the undercut. So there is support there, and this is what I'm finding with my dentures. And, you know, I've made thousands of dentures. I've been doing this for over 30 years. I've always had problems with rest seats. Even if I take the best impression that I can take, it's absolutely perfect. What seems to happen for me, and I'd be interested to know what happens with you guys, but for me, if that chrome doesn't seat properly, it is 90% of the time, it is where those rest seats are. And if I cut the rest seats off, it fits perfectly. And I don't know why. I haven't figured it out 100%. Maybe some other people can shed some light on this. My theory is that because it's the occlusal surface of the tooth, slightest little imperfection, whether that's in the model or the cast metal framework or the milled or the sintered framework, whatever it is, if there's just the slightest imperfection, it will not seat properly and it will not fit. That's one of my findings. However, I think the biggest thing is, if it's on the occlusal surface, it's just got no give. There's no tolerance at all. And if your tooth is reciprocated each side and you're just sat on the side of the undercut, it's got a little bit more give. It's still supported on that tooth, but the whole thing is a little bit more fluid. The denture is a little bit more passive, so shall we say, on the fit, the way that it rests and interacts with those remaining teeth. And I've had good results, but sometimes we need a rest date and the tooth needs to be adjusted, or this is usually when there's overcrowding, or there's just nowhere to put a clasp, unless the teeth are adjusted so that we can bring a clasp up over the occlusal surface and onto the buccal side of the teeth. But I don't like doing that either unless I can help it. But I'm being called for a patient, so I'll finish it there, guys. Thanks for watching, and I'll see you in the next one.